Dr. Respi Rungta, Faculty Department of Rheumatology, SSKM Hospital, Kolkata. Our topic is EULAR ACR Criteria for Diagnosis Rheumatoid Arthritis in case of multiple joint pain.
Good afternoon. So I think I'll just quickly go on to the classification criteria. They started in 1956 and then there were repeated revisions. But right now what we are using is the 2010 ACR EULAR classification criteria. So this is the criteria. So we'll discuss all the 5 points one by one. So who is the target population? Who should be tested? So the patients who have at least one joint with definite clinical synovitis or swelling, and when this synovitis is not better explained by another disease. So these are the people who should, on whom we should be applying these criteria to. So what does this mean? So at least one joint with definite clinical synovitis or swelling. This is basically on clinical examination. If required, we can do like an imaging to confirm it, but this is the criteria says clinical synovitis. And other differential diagnosis which should be excluded is that the patient should not have other diseases which can explain the arthritis like lupus, psoriatic arthritis or gout. So after this we apply this criteria. So there are A, B, C, D, there are 4 categories and we give a score with a maximum of 5 plus 3 plus 2. So 10, and out of this the patient should score at least 6 or more than 6 to be classified as having definite RA. If the patient's score is less than 6, but which can happen in cases of very early arthritis, the patient can be reassessed at a later date if clinically relevant. So then how do we assess it? So the most important one is the joint involvement. So one large joint gets 0 point. 2 to 10 large joint gets 1 point. 1 to 3 small joints with or without involvement of the large joint. So basically, if there is one large joint plus 2 small joints, this is what we should score, which should get 2 points. If there are 4 to 10 large small joints with or without involvement of the large joints, it should get 3 points. And more than 10 joints, out of which at least one joint should be a small joint, should get 5 points. So what are the large and small joint? This looks very complicated, but I think with use it's easier to understand. So this is any swollen or tender joint on examination may be confirmed by imaging if required. So what are the joints which are excluded? This is what we should all be knowing. The DIP joints, the distal interphalangeal joints, the first carpometacarpal joints and the first MTP joints are excluded from assessment because these are joints which are not commonly seen in rheumatoid arthritis. So these are excluded. What are the small joints? The metacarpophalangeal joints, the PIP joints, the 2nd to 5th metatarsophalangeal joints, the thumb IP joints and the wrists. So up till the wrists, the joints are small. So from proximal to the wrist, they are large joints. So basically the elbow, shoulder, hip, knees and ankles are included in the large joints. So what about these other joints, the temporomandibular, the acromioclavicular and the sternoclavicular, which are involved? In fact, the temporomandibular is quite commonly seen with RA. So if that is involved, we can, so if the other joints are involved, we can include them in these 4 categories. So so then we can score them as per the scoring given on the right. So this is how we score the joint involvement. So coming on to the serology and the acute phase reactants. So if both RF and anti-CCP are negative, that fetches 0 point. If they are low positive, if either of them are low positive, that fetches 2 points. And if either of them are high positive, it fetches 3 points. If the CRP and DSR are normal, then it's 0. But if either of them are abnormal, then that fetches 1 point. So a negative value means it should be less than or just equal to the upper limit of normal. Low positive means 3 times or lesser than the upper limit of normal. High positive means more than 3 times the upper limit of normal. Sometimes we, from the periphery labs, nowadays we still get latex tests for rheumatoid factors. So in that case, we just get a positive or a negative report. In that case, if with a latex agglutination test, a positive result should be scored as a low positive RF. And for the CRP or ESR, that's defined by the laboratory standards and is scored as 0 or 1. Coming on to the last thing, the duration of symptoms, less than 6 weeks is 0 and more than 6 weeks is 1. So this is basically patient reported. So if the patient says 6 weeks or less, then it's 0. Then if more, then it's 1. So if score of less than 6 out of 10 is not having, and it's not classified as having RA, we can repeat it at a later date if required. So I'll just leave you with this. This is you can all find it online. I find it quite easy to use. That's why I've put it up. Thank you.
Only one question. No question.
Sorry, temporomandibular joint comes in other joints, sir. It is not classified as either small or a big joint, but in like 2 to 10 or more than 10, we can classify them as another joint. Temporomandibular, acromioclavicular and sternoclavicular are classified as other joints.
Okay, thank you very much. Now we can conclude this session. Thank you very much for nice presentation, all the speakers.